Hello, my name is Kristin Prelipp, and I'm the Public Information Officer and Communications Manager for the Orange County Health Department. Welcome to the first episode of Public Health Chat. In each episode, we'll meet some of the wonderful people who work in public health, and we'll explore a variety of topics. First, I would like to introduce today's participants. We are joined by the Orange County Health Director, Quintana Stewart, by Dinah Jeffries, the Emergency Services Director for Orange County, and finally, Rebecca Crawford, who is the Finance Director for the Health Department, but during the COVID-19 pandemic has also been working on special projects. Quintana, if you would, please give us a COVID-19 update for Orange County, North Carolina.
Sure. So here in North Carolina, we've seen a total of 236,407 confirmed COVID cases, lab confirmed. Unfortunately, we've also seen 3,856 deaths across the state. Here in Orange County, we've seen a total of 2,874 confirmed cases, and we've seen 57 deaths. This pandemic is real, and we have all been going through it and fighting, to suppress this virus since March. We are seeing an increase in cases across the state as well as here locally in Orange County. What we're seeing, our new cases here in the county, they are occurring across the county and not in one specific area of the county. So this may be indicative that community members are getting COVID fatigue and we're getting tired. So I really want to just take a second to first say thank you and job well done, because Orange County has really done a great job throughout this pandemic with slowing the spread of this virus in our community. So I say thank you, I applaud you, and I want to say don't give up, don't quit, because we can get through this, and we have shown that we are able to suppress and flatten that curve. And so I just want to encourage everyone to remain vigilant about wearing your mask anytime you're out in public, waiting 6 feet apart, and then washing your hands often, frequently. So I just want to say you've done a great job, and we can continue, and we're going to get through this. But I would be remiss to not point out and say our case count is going in the wrong direction. So I just want to say thank you and encourage you all to get back in there, because we can get through this. We'll continue to monitor this uptick to see if we can identify a specific cause or source of the spread. But in addition to our case count, we also look at a few other metrics to determine how the virus is spreading in the community. So we look at COVID-like related illnesses, and we want to see how many folks have presented in our hospital ED with some of these signs and symptoms for COVID-19. Over the past 2 weeks, we have seen an uptick in the number of cases and visits to the ED. We went from 43 visits up to 52 visits. 2 weeks prior to this, when we looked at the data, we were seeing a decrease, and we actually went down a little over 20 visits within that 2-week time period. We also look at percent positive cases. So that's telling us, out of all the tests that we've conducted in the county, what percent of those test results have come back positive. Right now, for Orange County, we're hovering around 3% for our positive cases. So based on our county data, this is not bad. This is good. The overall goal is to be at 5% or less. And so we're at 3%. But again, I want to encourage folks to remain vigilant, because we have seen times in the last couple of weeks where we were as low as 1.3% positive. So we want to get that number back down if we can, but kudos, because we are staying under 5%, and that is the ultimate goal. We look at the total number of tests conducted in the county. And so we continue to ramp up and host community testing events. And we are testing both asymptomatic as well as symptomatic individuals. I know that was a big concern early on in the event when testing supplies were limited, but we are now opening that up, and we're testing both asymptomatic and symptomatic community members. So in Orange County, we've conducted 57,188 total tests. So this number does not represent the number of people that have been tested, because we do have some community members that have been tested multiple times. But total, we've run 57,000 tests, and that's really good for our community. So we also look at some things such as how many contact tracers do we have to do our case investigation and contact tracing. And I'm happy to say that we have adequate staffing at this time to handle our caseload. And we continue to onboard and train new staff weekly, as we see the need to increase and, meet the surge. We have staff that we've trained and we're running them through the process. So our staffing looks good right now with our case investigation and contact tracing. And then we also have a total, at this time, we have 6 outbreaks in the county. So we have outbreaks in 2 nursing homes, 2 residential facilities, and then 2 correctional facilities. And so a facility will remain in outbreak status until they're able to go 28 days straight without a new positive case. So again, kudos to our Congress sites who have been working with us in partnership throughout this pandemic, being very vigilant around their infection control practices. That's with staff and residents, and they're also doing the routine testing that we require of them. So again, this is not the best news that I could present at this time, but it is where we are right now during the pandemic. And I am encouraged and hopeful, and I know that together we're going to get through this and really turn these numbers around.
All right. Well, thank you for that update. Let's turn to our first topic. I think that community members would be very interested to learn more about the inner workings of our local response to this global pandemic. Dinah and Quintana, I know you all work closely together to lead COVID-19 response in Orange County. What are your roles in that response and how do you work together?
I think the key words here are working together, because without the teamwork, this would not work. And our teams have different missions, and the 2 of us communicate frequently to assure that our teams have the support they need. My team's role is to ensure the safety of residents and responders and the continuity of services. Early on in this pandemic, we followed FEMA, which is Federal Emergency Management Agency, their best practice recommendation of implementing the MAC group. That's Multi-Agency Coordination Group. What that did was, early on, it provided policy guidance. It supported resource prioritization and allocation. It enabled decision-making amongst all of the leaders who were represented on this group. And represented on the group were elected officials, senior decision makers, senior public safety officials, and subject matter experts. One of the things that was so important with this group was defining what the mission was. And early on, we recognized that the priority of this group overall was saving lives. And that was most important to us. With this being a very difficult crisis in our community, and everybody having to be so much more flexible, we have had to be very creative in much of our response. But our role, again, is to work together. That includes the community, because, again, I've often said that our residents are definitely the leaders in the community. And I've always used the old African proverb of "it takes a village to raise a child." It definitely applies to this pandemic and taking care of one another more than ever. Our nonprofits still need help. We still need to donate to our local food pantries and all of our nonprofits in the area. Consider volunteering, and by all means, please continue checking on those neighbors who are in that vulnerable population, and keep up the great work that we're all doing.
Yeah, and so I would say for public health, communicable disease control is actually one of our core mandates. It's something that we are required to do by law. So we tend to focus on figuring out why and how the disease is spreading, and then we implement control measures to slow or stop the spread of that. So this is not anything new for public health. We are accustomed to doing case investigation and contact tracing, and again implementing control measures. I would say COVID-19 is simply a new disease. So with public health, we have appreciated and enjoyed our partnership with Dinah and her team over at Emergency Services, because they have been very instrumental in helping us do exactly what we have been doing for decades. So getting in there and controlling this disease. So it's been a wonderful partnership. And again, our focus has been on prevention and mitigating the disease. And that complements and works very well with EMS and our life safety goals.
Right. Well, thank you both for that. So now we're going to move on to talk about K through 12 schools. Here in Orange County, we have two public school systems, Chapel Hill Carborough City Schools and Orange County Schools. The North Carolina Department of Health and Human Services, in consultation with the State Board of Education and Department of Public Instruction, issued guidance for schools this past summer. Schools were asked to plan for reopening under 3 scenarios. There was Plan A, which is minimum social distancing, Plan B, which is moderate social distancing, and Plan C, which is remote learning only. Rebecca Crawford, I know you have been working closely with both school systems. Currently, they are operating under Plan C, which means schools are in session, but students are learning from home with the use of web-based technologies. My first question is, why aren't the two school systems operating under Plan A, which would be minimum social distancing?
Even though the governor has said as of October 5th, all North Carolina school districts have the ability to be in Plan A for kindergarten through 5th grade, since the research seems to be showing that younger children are less likely to be impacted by severe illness related to COVID-19. Both Orange County school systems have decided not to move into Plan A or Plan B until late January at the earliest. They both want to take a slow, cautious approach to reopening, since we do continue to see rising cases in the state and the country, even if Orange County doesn't have as high of a % positive of tests right now as it has in the past. Pre-K students, students in special settings, exceptional children, and those that have been unsuccessful in remote learning will go back first, but in limited numbers, so that school staff can take all the necessary safety precautions and ensure maximum social distancing, which we know will be harder once there are more kids in a building.
Okay. If you don't mind, please explain the metrics that the schools are using to decide about reopening.
The health department's data team created the COVID-19 metrics, which you can find on our website, and we update those weekly, to match the state's metrics that are used to guide each step of the state's reopening. We wanted to make sure that we had easy to follow graphs that can be understood on most levels of literacy to show how COVID-19 is impacting our county, and then compare them to the state's metrics. We look at 4-week sections to identify trends, and we have 4 metrics of those that we review that are similar to the ones that Quintana was discussing earlier. We look at the number of confirmed cases per week to make sure that we can successfully case investigate and contact trace them within a 24 to 48 hour period of notification to the health department. And that helps us to slow the spread of COVID-19. We also look at % positive of total tests in order to see how widespread community transmission is. We look at the number of emergency department visits for that COVID-like illness or CLI each week. And again, that means symptoms that are close or similar to COVID. We look at the number of COVID cases in our UNC hospitals to make sure that we aren't overloading them and we can monitor their capacity. So the schools can use this data along with any other data that they may collect from families and from staff to decide when it's safe to reopen schools to the next phase.
Okay. My last question is, why doesn't the health department tell schools when to open and close?
The school district leaders and boards of education are the experts about education of children, not the health department. We can make recommendations and provide information and answer questions, but the health department doesn't have the statutory authority to open or close schools.
Okay, well, thank you. So our final topic is Halloween. In a year in which we've all given up so much, the burning question is, can we still have fun on Halloween? And if so, could you offer any tips on how we can all safely celebrate Halloween?
So I'll start with this one, and the answer is yes, we can still celebrate Halloween. This year, we need everyone to get really creative in making Halloween fun and memorable. But there are several low-risk activities that we can participate in to still make Halloween fun. Some of those low-risk activities would include a pumpkin carving contest amongst your household members. You could do things such as have a Halloween movie night with your household members. Or you could even do trick-or-treat scavenger hunt style around your home or around your household, again, with just your household contacts. But there are several things that we can do to make Halloween fun. We just have to figure out how to do it in a safer way this year.
And I think probably one of my favorite ideas is the virtual Halloween, and which people dress up and share their ideas of costumes. That's very safe. And the one thing that we want to encourage also, like Quintana says over and over again, is again, safety. You can still have fun, but you don't want one night of fun to ruin your health for the rest of the year. So keep it up with family and household members, be creative, and Halloween will be back again.
Right, thank you. So my final, very important public health question, I would love to know, what is each of your favorite Halloween candy or treat? Dinah, you get to go first.
Anything chocolate.
How about you, Rebecca?
I love Reese's peanut butter cup pumpkins.
I'm gonna vote for Snickers, yummy, and then Quintana.
I think my favorite would be Baby Ruth, with Snickers running a very close second.
Excellent. All right. Well, so I want to thank each of you all for your hard work during this pandemic, for your leadership, and for participating in this public health chat today. Stay safe and healthy, everyone. Bye.
Bye.